Hi, my name is Lesley Gabel. I'm the co-CEO of Prevention Resources as well as the project director for the Safe Communities Coalition in Hunterdon County, New Jersey.
Hi, I'm Peggy Dowd, the project coordinator for the Hunterdon County Safe Communities Coalition.
We are so grateful that we had this opportunity to work with CATCA and our trainers, Catherine Brunson and Stephanie Strutner. We were able to learn a lot. We've been working on reducing opioids and the misuse of, in particular, the misuse of prescription drugs for quite some time. So when we took a look at this project, we really wanted to try and think outside the box of some of the areas that we had worked on.
The coalition's been working with strategies for many years in order to reduce access and availability in our county. We have highlighted and promoted our prescription drop-off boxes. We have talked about safe storage in the home, cleaning out medicine cabinets, and what people can do to protect their homes.
We'd never really looked at cost analysis and impact as far as moving and changing the thought process of how we manage pain in our community. So we decided to look at cost, look at the determinations by talking to many different community members, such as those that are in alternative to pain management, insurance companies, prescribers. And some of the frustration prescribers have, we found, is that they want to prescribe for alternatives, but in some cases, they're not covered.
As opioid overdoses increase, it's really important for us to expand our outreach and education and have a call to action for both medical prescribers and also insurance companies. In our research, we've discovered that most insurance companies actually do cover alternative therapies much more than they did in previous years, and that the demand for alternative therapies is increasing among community members.
So we decided with this project is to truly be able to bring all this information together, create information that would speak to those that are decision makers, at the same time educating some of our vulnerable populations, such as those that are likely prescribed alternatives, such as athletes, and our senior population in particular. Older adults are at a high rate of being prescribed, as well as sometimes misusing. So we looked at some of our vulnerable populations, and we were able to put together commercials and public service announcements, as well as teach some of our other members of our community how to dispose properly at home. Especially during this pandemic, we saw many people not wanting to go out and being told not to go out. So we really created some strategies, social media, called on our friends at law enforcement to help us throughout the pandemic of ways to properly dispose. We also were aware, in particular, that our Latino population at times bring medications in from outside the country. And we knew that in speaking to members of our Latino population that they didn't feel comfortable at times going to law enforcement where our prescription drop-off boxes were. So we had to create ways and education, and we did that through town hall meetings as well as online media and videos to help teach in Spanish how to do that.
One great advantage of working with the Non-Opioid Choices Project this year is that we were able to add survey questions, additional survey questions to our PRIDE student survey in order to obtain baseline data for alternative therapies for pain. So we added a question which said, in the last year, how often have you used, and then we listed physical therapy, acupuncture, chiropractic, ice and heat, over-the-counter medications, and even non-opioid pain medications such as Exparel.
One of the other areas of our most vulnerable population is our youth, and how to connect them to resources in a manner and method that speaks to them. And we were fortunate to be able to create a help app working with our partners at Positive Youth, and create it with some incredible teens from the local code club at a high school. And it's incredible. So this help app has been launched, as well as on this help app, it tells our community where to dispose of prescription drugs. In particular, it speaks to and designed by youth. We know that our youth reach out through technology, and we wanted to make sure that we were able to connect through technology to our youth.
We've also have concluded a cost analysis that shows that 3 months worth of alternative therapy which targets the root cause of pain, is actually more cost effective than a patient being on a prescription opioid for up to a year later. And of course, the risk of addiction and overdose is the greatest cost.